You're listening to the Hoofcare Companion, the podcast dedicated to the science, art and practicalities of keeping horses sound from the ground up. I'm your host, Marc Jerram, and each episode will take a deep dive into the world of hoof anatomy, pathology, care and rehabilitation. Whether you're a farrier, veterinarian, therapist or simply passionate about horse health, this is your space to learn, question and grow. We'll explore the latest research, time-tested methods and real-world case studies to help you better understand the structures beneath the hoof capsule and how to support them when things go wrong. Because good hoof care isn't just about trimming and shoeing, it's about understanding the whole horse. So let's get stuck into today's topic. Episode 15, Cushing's disease, a complete overview.
Introduction.
Cushing's disease in the horse, correctly termed pituitary pars intermedia dysfunction, represents one of the most significant chronic endocrine disorders encountered by farriers, veterinarians and owners alike. Its relevance within farriery is profound, not only because of its strong association with laminitis, but also due to its wide-ranging effects on hoof horn quality, tissue resilience, immune competence and the horse's ability to tolerate mechanical stress. In many cases, Cushing's disease underpins persistent or recurrent foot pathology that fails to respond predictably to conventional trimming and shoeing strategies, leading to frustration for both professionals and owners when the underlying cause is not recognised. As advances in nutrition, preventative medicine and husbandry have extended the lifespan of the domestic horse, age-related disorders have become increasingly prevalent. Horses that would historically have been retired or euthanized at a younger age are now routinely maintained into their late teens and 20s. Cushing's disease has therefore transitioned from being considered an occasional diagnosis to one that must be routinely considered when assessing older horses and ponies. This is particularly relevant in leisure and companion horses, where subtle clinical signs may go unnoticed for extended periods. For the farrier, Cushing's disease demands a depth of understanding that extends well beyond recognition of a long or curly coat. The disorder is systemic and progressive, influencing endocrine balance, vascular regulation, metabolic efficiency, and immune surveillance. These systemic changes often manifest within the foot before more obvious external signs are apparent. The farrier may therefore be the first professional to suspect the presence of the disease, particularly when faced with unexplained laminitic episodes, persistent white line disease, repeated hoof abscessation, or deterioration in horn quality in an older horse that is otherwise well managed. Understanding Cushing's disease is essential not only for effective hoof care, but also for professional communication. The farrier occupies a critical position in the multidisciplinary management of these horses, providing regular monitoring of the feet and detecting early indicators of decline or improvement. By appreciating the nature of the disease and its long-term trajectory, the farrier is better equipped to support informed decision-making, realistic expectations, and ultimately improved welfare outcomes.
Understanding Cushing's disease in the horse.
Cushing's disease in the horse arises from dysfunction within the pituitary gland, specifically the pars intermedia. In the healthy horse, the pars intermedia is tightly regulated by dopamine released from neurons within the hypothalamus. Dopamine acts as an inhibitory neurotransmitter, suppressing excessive hormone production and maintaining endocrine equilibrium. This dopaminergic control is fundamental to normal pituitary function and metabolic stability. In Cushing's disease, the dopaminergic neurons that regulate the pars intermedia undergo progressive degeneration. As these neurons deteriorate, dopamine production declines, and inhibitory control over the pars intermedia is gradually lost. The result is hyperplasia and hypertrophy of the pars intermedia, leading to excessive and dysregulated hormone secretion. This process is slow, insidious and irreversible, reflecting the neurodegenerative nature of the disease. The hyperactive pars intermedia produces excessive quantities of propiomelaanocortin-derived peptides. These include adrenocorticotropic hormone, alpha melanocyte, stimulating hormone, beta endorphins, and other biologically active fragments. While adrenocorticotropic hormone is traditionally associated with stimulation of cortisol production in other species, the relationship in horses is more complex and does not always result in consistently elevated circulating cortisol levels. Nevertheless, the overall hormonal imbalance exerts profound effects on multiple physiological systems. These hormonal disturbances disrupt glucose and lipid metabolism, impair immune function, alter thermoregulation, and affect vascular tone. Of particular relevance to farriery is the impact on the digital vasculature and laminar tissues of the foot. Altered blood flow regulation, combined with metabolic and inflammatory changes, compromises the integrity of the laminar attachment, increasing susceptibility to laminitis even in the absence of obvious dietary or mechanical triggers. Crucially, Cushing's disease is not an acute illness, but a progressive, lifelong condition. Clinical signs evolve gradually, and the disease trajectory varies between individuals. Some horses remain relatively stable for years, while others deteriorate rapidly once clinical signs emerge. For the farrier, understanding this progressive nature is essential when planning long-term hoof care strategies and communicating prognosis to owners.
Thorough assessment of the horse.
Thorough assessment of a horse suspected of Cushing's disease requires a holistic, methodical, and longitudinal approach. The farrier's assessment often begins long before a formal veterinary diagnosis is made. Regular attendance places the farrier in a unique position to observe subtle changes over time, many of which may be overlooked during infrequent veterinary examinations. A detailed history forms the foundation of assessment. Age is a critical consideration as the prevalence of Cushing's disease increases markedly in horses over 15 years old. Enquiry should be made regarding previous episodes of laminitis, including mild or self-resolving events, as recurrent low-grade laminitis is a common early manifestation. Owners may describe intermittent foot soreness, pottery movement on hard ground, or reluctance to turn, all of which warrant further consideration. Changes in coat shedding patterns are particularly significant. Delayed shedding in spring, patchy retention of winter coat, or development of excessively long hair in specific regions may represent early endocrine disruption rather than simple seasonal variation. Alterations in body condition, including unexplained weight loss, abnormal fat deposition, or difficulty maintaining top-line muscle, are also important historical indicators. Static assessment provides valuable insight into systemic health. Horses with Cushing's disease frequently exhibit muscle wastage along the top line, shoulders, and hindquarters, resulting in a hollowed appearance despite adequate nutrition. In contrast, fat deposition may occur in specific areas such as above the eyes, along the crest of the neck, or around the tail head. This redistribution of body fat, combined with muscle loss, is characteristic of endocrine dysfunction. Postural assessment is equally informative. Horses may stand with the forelimbs camped out or frequently shift weight between feet, suggesting chronic laminitic discomfort. The presence of a bounding digital pulse, increased hoof temperature, or altered weight bearing should always be investigated further. Dynamic assessment is essential, particularly as pain-related behaviours may be masked by elevated endorphin levels associated with Cushing's disease. Horses may not display overt lameness, but often show shortened stride length, stiffness when turning, or reluctance to move on firm surfaces. Observing the horse at walk and trot, on different surfaces, and during manoeuvres such as tight turns, can reveal subtle gait abnormalities indicative of laminar pathology. Hoof assessment remains central to the farrier's role. Cushing's disease often results in slow, inconsistent, and poor quality horn growth. The hoof wall may appear brittle, shelly, or prone to cracking. White line separation is common and may predispose to recurrent abscessation. Growth rings may be uneven or divergent, reflecting periods of metabolic instability or subclinical laminitic episodes. Sole depth is frequently reduced, increasing susceptibility to bruising and mechanical trauma. Through careful and consistent assessment, the farrier can identify early changes and intervene proactively.
Causes of Cushing's disease.
The primary cause of Cushing's disease in the horse is age-related degeneration of dopaminergic neurons within the hypothalamus. This degeneration is thought to be driven predominantly by cumulative oxidative stress. Over time, reactive oxygen species cause cellular damage that overwhelms antioxidant defense mechanisms, leading to progressive neuronal dysfunction and loss. Aging is therefore the most significant risk factor, and the prevalence of Cushing's disease increases sharply with advancing years. However, not all older horses develop the condition, suggesting that additional factors influence susceptibility. Genetic predisposition has been proposed, with certain breeds and bloodlines appearing overrepresented, although definitive genetic markers have yet to be identified. Environmental and management factors may also contribute indirectly. Chronic stress, whether physical or psychological, may increase oxidative burden and exacerbate neurodegenerative processes. Long-term illness, poor nutritional status, or inadequate management may therefore accelerate disease expression in susceptible individuals. Dietary factors play an important contributory role, particularly through their influence on insulin regulation. Horses consuming diets high in non-structural carbohydrates may develop insulin dysregulation, which frequently coexists with Cushing's disease. While insulin dysregulation does not cause Cushing's disease, it significantly amplifies its clinical consequences, particularly in relation to laminitis risk. Cushing's disease should therefore be viewed within the broader context of equine and metabolic health rather than as an isolated endocrine disorder.
Clinical signs of Cushing's disease.
The clinical signs of Cushing's disease are diverse, variable, and often slow to develop. Early signs may be subtle and easily attributed to normal aging, seasonal change, or reduced workload. This gradual onset contributes to delayed diagnosis in many cases. One of the most widely recognised signs is abnormal hair coat. Horses may exhibit delayed shedding, patchy retention of winter coat, or development of an excessively long, thick or curly coat that persists year-round. In early disease, these changes may be mild and inconsistent, becoming more pronounced as the condition progresses. Changes in demeanour and performance are also common. Affected horses may appear lethargic, dull or unwilling to exercise. Reduced stamina and prolonged recovery times may be observed. Muscle wastage, particularly along the top line and hindquarters, reflects altered protein metabolism and reduced anabolic hormone influence. Despite this muscle loss, some horses maintain or gain weight due to abnormal fat deposition. Laminitis represents the most clinically significant manifestation of Cushing's disease. Presentation varies widely, ranging from acute severe episodes to chronic low-grade laminitis that gradually undermines hoof integrity. Recurrent laminitis without an obvious trigger should always raise suspicion of an underlying endocrine disorder. Recurrent hoof abscessation is also common and often affects multiple feet. These abscesses may recur despite appropriate treatment and are thought to arise from compromised laminar attachment, poor horn quality, and impaired immune function. Additional clinical signs include increased thirst and urination, excessive sweating, delayed wound healing, and increased susceptibility to infections. Collectively, these signs reflect the systemic nature of the disease.
Use of veterinary diagnostics.
Veterinary diagnosis of Cushing's disease relies on integration of clinical findings with laboratory testing. Measurement of circulating adrenocorticotropic hormone concentration is the most commonly used diagnostic approach. However, interpretation is complicated by marked seasonal variation, with higher hormone concentrations typically observed in late summer and autumn. Seasonally adjusted reference ranges are therefore essential to avoid misinterpretation. In cases where basal hormone levels are equivocal, dynamic testing may be employed. The thyrotropin-releasing hormone stimulation test is considered highly sensitive, particularly in early disease. This test assesses the responsiveness of the pars intermedia, with affected horses demonstrating an exaggerated hormonal response following stimulation. Assessment of insulin and glucose dynamics is frequently undertaken concurrently, particularly in horses with a history of laminitis. Identification of insulin dysregulation is critical, as it necessitates targeted dietary and management interventions to reduce laminitis risk. Imaging plays a vital supportive role in cases with hoof involvement. Radiography allows assessment of distal phalanx position, sole depth, and chronic structural changes associated with laminitis. For the farrier, access to radiographic information is invaluable in guiding trimming and shoeing decisions and monitoring progression over time.
Veterinary treatment.
The cornerstone of veterinary treatment for Cushing's disease is pharmacological management aimed at restoring dopaminergic inhibition of the pars intermedia. Pergolide mesylate is the treatment of choice and has been shown to reduce hormone overproduction and improve clinical signs in the majority of affected horses. Treatment is lifelong, as Cushing's disease is progressive and incurable. Dosage is tailored to the individual and adjusted based on clinical response and follow-up testing. Many horses demonstrate significant improvement in coat shedding, energy levels, and laminitis control once stabilised on appropriate medication. Initial side effects may include reduced appetite, lethargy, or mild gastrointestinal upset, particularly during the early stages of treatment. These effects are often transient and can be mitigated through gradual dose escalation and close monitoring. Veterinary management also encompasses comprehensive healthcare, including dental maintenance, parasite control, vaccination, and nutritional optimization. Effective management is inherently multidisciplinary, requiring ongoing collaboration between veterinarian, farrier, and owner.
Laminitis risk and farriery management.
Laminitis represents the most serious and farrier-relevant complication of Cushing's disease. The risk arises from the combined effects of hormonal imbalance, insulin dysregulation, and altered vascular control within the foot. Even horses receiving appropriate medical treatment remain at increased risk compared to unaffected individuals. Farriery management focuses on minimising mechanical stress on compromised laminar tissues. Regular trimming is essential to maintain optimal hoof balance and reduce leverage forces. Trimming intervals may need to be shortened and conservative strategies adopted to avoid destabilising weakened structures. Radiographic guidance is invaluable in horses with active or historical laminitis, allowing alignment of the hoof capsule with the distal phalanx. Sole protection is often required due to reduced sole depth and increased sensitivity. Supportive shoeing, pads or hoof boots may be employed depending on individual needs. Early detection remains critical. Subtle changes in growth ring pattern, digital pulse, stance or movement should prompt immediate communication with the veterinary surgeon. Timely intervention can prevent progression to severe laminitic damage.
Alternative herbal supplementation.
Interest in alternative and herbal supplementation for Cushing's disease has increased in recent years. Many products claim to support pituitary function, hormonal balance, or antioxidant status. While anecdotal reports of improvement exist, robust scientific evidence remains limited. From a professional perspective, herbal supplementation should not be considered a replacement for evidence-based veterinary treatment. In some cases, supplements may be used as adjuncts under veterinary guidance, but caution is essential due to potential interactions with prescribed medication. The farrier plays an important observational role, monitoring hoof growth, horn quality, and laminitis incidence to assess whether a management strategy is effective. Clear communication and realistic expectations are essential when alternative therapies are considered.
Long-term prognosis.
The long-term prognosis for horses with Cushing's disease varies widely and depends on age at diagnosis, disease severity, response to treatment, and the presence of complications such as laminitis. Early diagnosis and prompt initiation of treatment significantly improve outcomes. Many horses respond well to medical management and maintain a good quality of life for many years. Improvement in coat shedding, energy levels and hoof health is commonly observed once the disease is stabilised. horses without severe laminitic damage generally have a more favourable prognosis. Conversely, horses with chronic laminitis and significant structural changes may require intensive lifelong management. As Cushing's disease is progressive, regular reassessment is essential, and both medication and farriery strategies must evolve over time.
Conclusion.
Cushing's disease is a complex progressive endocrine disorder with far-reaching implications for the horse and those responsible for its care. For the farrier, it presents both a challenge and an opportunity to contribute meaningfully to long-term welfare. Through informed assessment, vigilant monitoring, evidence-based management and close collaboration with veterinary colleagues, many horses with Cushing's disease can continue to live comfortable, dignified and pain-free lives well into old age. If you would like to learn more about hoof care, then visit thefarrier.co.uk, an educational platform created to deepen understanding of hoof health, farriery science and equine soundness. This website brings together practical experience, academic insight and real-world application designed for farriers, veterinarians, students and horse owners who want to go beyond surface-level knowledge and truly understand how the hoof functions as part of the whole horse. Within the articles section of thefarrier.co.uk, you will find a growing library of long-form educational content covering both foundational and advanced topics in farriery. These articles explore the structure and function of the hoof wall, sole, frog and internal anatomy, explaining how each component contributes to load bearing, shock absorption and movement. More advanced articles examine balance, limb alignment, hoof pastern axis and the biomechanical consequences of trimming and shoeing decisions over time. There is also a strong focus on pathology and prevention. Topics such as laminitis, lameness and poor performance are discussed from a farriery perspective, placing hoof care within the wider context of systemic health, management and veterinary collaboration. These articles are written to encourage critical thinking, helping readers understand not just what to do, but why they are doing it. At the heart of thefarrier.co.uk is the Hoofcare Companion, a comprehensive hardback book authored by Marc Jerram. This book is designed as a long-term reference rather than a quick read. It brings together decades of professional experience, detailed explanations and high-quality imagery to guide readers through hoof anatomy, balance, pathology and practical decision-making. Whether you are a professional or a committed horse owner, this book is intended to build confidence, understanding and consistency in hoof care. In addition to education, thefarrier.co.uk offers professional consultation services. These consultations provide in-depth assessment of hoof balance, movement and long-term soundness using modern gait analysis and measurement tools. Consultations can be used to support rehabilitation cases, performance horses or those with ongoing soundness concerns, offering clear guidance and objective monitoring over time. Whether you're here to learn, to refine your skills or to seek professional insight for your horse, thefarrier.co.uk exists to support informed decisions, better outcomes and healthier hooves for the long term. Thank you for listening to the Hoofcare Companion. Please follow, rate and share this podcast on your social media to help the Hoofcare Companion grow and reach all of those who care for our equine friends all around the world. Visit the links in the show notes to obtain your copy of my books or to interact on my social media channels. Until next time, thank you for listening, because a healthy hoof is a happy horse.